Welcome to This Week in Surgery Centers. If you're in the ASC industry, then you're in the right place. Every week, we'll start the episode off by sharing an interesting conversation we had with our featured guest, and then we'll close the episode by recapping the latest news impacting surgery centers. We're excited to share with you what we have, so let's get started and see what the industry's been up to. Hi, everyone. I hope you all had a wonderful Thanksgiving with your loved ones. Here's what you can expect on today's episode. James McClung is an ASC Developer and Consultant at Reliant Medical Services, and he's here to share with us everything we need to know about performing an effective mock survey and how you can make sure that you're prepared for when an actual surveyor shows up in your lobby unannounced with the clipboard in hand, ready to evaluate your ASC. In our news recap, we'll cover Google Cloud and Epic's latest plans, a drug shortage created by TikTok, a dire rural hospital situation in Mississippi, and of course, end the news segment with a positive story about a 9-year-old girl who saved her classmate's life by performing the Heimlich. Hope everyone enjoys the episode, and here's what's going on this week in surgery centers.
All right. How's it going, everyone? I am your host, Raphael Kinsby, here at This Week in Surgery Centers. We have a really exciting episode this week. This week, we are joined by James McClung of Reliant Medical Services, and we're going to be covering a really fun topic today on performing an effective mock survey in your surgery center. There's a lot of interesting things here, and I know a lot of our guests, a lot of our listeners are excited to hear about this topic. And I want to just kind of, before we go in, turn it over to James. For anyone who doesn't know you or hasn't, had a chance to kind of hear about what you do, can you give our listeners just a bit of kind of just an overview on you?
Absolutely. My name is James McClung. I'm a registered nurse by trade. I've ended up starting my own business a little bit with consulting and doing mock surveys. I've been on the HHC executive or expert content committee. So they actually report to the standards committee at HHC. So no, I don't make the rules. Okay. But I help to advise on the rules. Also, I'm on the executive board of the state organization of ASCs here in Texas, which is TASC. And so they would be a representative for the state of Texas to ASCA, which everyone knows is the national organization. Okay. I've helped to run centers as administrator. I've been a director of nursing. I pretty much filled and operated in every position within an ASC. Yep. Plus, I've actually helped to build them as well, and design them. So let's just say I have a passion for ASCs.
That's awesome. Well, that's what we like to have here on the.
I like to tell people I do crosswalks on the weekend for fun. So which is a mock survey type thing. So
there we go. Well, that's one of the reasons that we wanted to have you on the pod. You've got a ton of just kind of expertise there, and obviously a passion for ASCs, which we have as well here at This Week in Surgery Center. So excited to jump in, and I think you're kind of leading off there. We are here to talk about mock surveys, and just to my understanding, and you know this better than I do, mock surveys are really to help you prepare for when you have actual surveyors that show up to your surgery center. They've got the checklist and clipboard in hand to evaluate your surgery center. But before we kind of dive directly into that process and what that looks like, can you give us a little bit of just understanding on kind of the accreditation process for ASCs and kind of the options on the accreditation side before we jump into the actual mock survey?
Sure. So accreditation, and I don't want to answer all the questions at once because I could probably just I'm so familiar with the process and blur it all out. But accreditation, it's the gold standard when it comes down to commercial payers. So a lot of commercial payers like to see centers accredited to work with that center in contracting. Now, I have not seen a center get denied a commercial payer contract because they were not accredited. So is accreditation required? Well, it depends on who you talk to, and it also depends on your state. However, in the state of Texas, accreditation is not required. However, a state license is to be open as ambulatory surgery center. Now,
Okay.
is accreditation the gold standard? I believe so. Accreditation is not it's not deemed status, pun intended, but
Yeah.
accreditation is more of a consultant type angle, right?
Yep.
That they take on it versus, like a state health department where they're coming in and they're more of an enforcing type attitude, right? Or,
Yep.
perspective on the inspection process. So.
That makes sense. That makes sense. And in terms of just for anyone who's not totally familiar with accreditation and kind of going through that a bit, can you give us a bit of background on kind of why the accreditation is necessary for an ASC, or why it would be one of the things an ASC would want to do?
Right. And so accreditation it all stems back to quality improvement, right? And the reason why I would say that every center should be accredited is because it's very similar to nursing, right?
Mm.
Now, no one in nursing wants to present themselves as a physician or an MD. But
Yep.
when you go to get a nursing degree, they want to promote as many nurses to a higher degree, a PhD in nursing, right? So you can promote the profession,
Yeah.
the industry, right? And so it provides a process that if you follow by it, you're not reinventing the wheel.
Yeah.
A process that is set up and ran to help you not only provide excellent quality care, but to improve your center, your care, and the industry. So
That makes sense.
it's a no-brainer in my mind. Yeah.
Yeah. So, the next thing that kind of comes to mind for me then is for a surgery center, is there a requirement for them to have accreditation to be able to perform cases, or are there certain cases that can't be performed if you don't have accreditation?
It depends on your state and it
Okay.
depends on your contracts, right?
Yeah.
So to be in network with Medicare, all you need is a state license, and you need to be licensed through the state.
Yep.
Now, most states that I know of, at least, what they'll do is, let's just be honest, most state departments are they're not overstaffed, right?
Yeah.
And so what they will do is give much more leeway to their inspections, or maybe not even come inspect you at all, right? Depending on the situation and your state, of course, if you are accredited.
I see.
And so it really depends on what state you're in. And then there is I've always been told that you have to be accredited to have commercial payer contracts. So Aetna and United Healthcare. Now, I've never seen that in practice, and I have seen ASCs that do not have accreditation have commercial payer contracts, right?
Okay.
However, that is on an individual entity basis or
Yeah.
ASC basis, including your state, because like Blue Cross Blue Shield has Blue Cross Blue Shield of Texas, right?
Yeah.
So you would have to approach your payer contracting specialist.
Awesome.
Depending on
Okay.
state.
That makes sense, and the state variation there seems fairly logical with kind of the different ways those are structured. So then, as I think kind of through that, and I'm sure this might vary by state as well, but one of the things that we've heard a lot of from different ASCs is that the process of getting accredited can be fairly rigorous, and many times more rigorous than it is for hospitals. Is that something that you found to be true, and kind of how do you see that varying for different ASCs?
So I would say that it is a very serious process. You're going to need the authority to, provide documentation such as ownership structure,
Yep.
right? Loan information potentially to open up a center when it's a de novo or a new build, right?
Yeah.
So you would be working very closely with a physician owner right,
Yep.
are have the authority to provide that information. So, at times a legal team could, be helpful 100%, right?
Yep.
And then in addition to that, you're not only just applying for accreditation, but you're looking to, especially in a de novo, you're looking to transfer over patients from either one facility to another or a doctor's office to an ASC, plus looking at timelines that don't have set dates, right? With commercial or Medicare contracts, commercial payer contracts. And so that's where it gets pretty tricky, and a specialist could help in that situation that has experience. I
Yep.
suggest never, working with someone solely that does not have experience in opening up a facility or an ASC facility.
Yeah.
Now, when it comes down to the difference between a hospital, I was a safety officer an emergency management manager of a hospital for 7 to 8 years, and
Oh wow.
you know, you're right, yeah. And so I've gone through JACO, Triple HC inspections, and is it? It's a different process, but is it more difficult? I would I would probably say no. It's just
Okay.
it's the same. It's just it could be strenuous, tedious work where you're having to
Yeah.
either create or put documents into place
Yeah.
that you should have been keeping up with from the living in the now. It's like I like to say it.
Yeah.
It's and that could be it's easier said than done sometimes. So
Yeah. Do you feel like the resourcing in hospitals versus ASCs are a little different and make the process any easier for hospitals versus ASCs when it comes to that?
oh man, hands down. Oh, hands down. Yeah. I would tell you, so in the hospital side, right, there is a department in person for everything.
Okay.
Oh yeah, and maybe some larger ASC management groups might have a quality department, but you would have
Yeah.
somebody come in and go, you've never seen before, and you then afterwards you would never see again.
Yeah.
And I actually worked for a surgical hospital, so it's like a glorified ASC. They put an emergency room physician
Yeah.
somewhere in the hospital, and you don't ever want to see them, right? And so it was more structured like in ASC, where you would have the people you would have people filling multiple roles,
I see.
right? So, but 100% in a hospital, they typically have a lot more resources, but that's what makes ASCs great.
Yep. That makes
In
a
my
ton
mind.
of sense. Makes a ton of sense there.
Absolutely.
So, kind of jumping forward and kind of getting into the compliance mock surveys a bit there. For someone who's totally brand new to mock surveys, can you kind of just walk us through it? How does it work? Kind of what are the components there to a mock survey?
Sure, absolutely. Well, the first thing that I would say to do is, if you are accredited currently, then reach out to your account executive for Triple HC or JACO and let them know that you were planning on a mock survey, right?
Yep.
And to be perfectly honest, typically mock surveys are a person doing a mock survey is contacted when a facility is not living in the now, and there might
Mm.
be things like backlog or right. You're looking
Yep.
to determine how bad it is, right, and
Yep.
what needs to be done to get up to speed to pass the inspection. So you you wanted to determine that first.
Yep.
Contact your account executive. Don't tell them any of that information, right?
Yeah.
But just let them know, because a lot of accrediting bodies like Triple HC JACO, they take more of a consultative perspective to the inspection process, and they might be able to help you or guide you through that process, right? And whether your experience is great with that or not, you're communicating with them and staying within communication with them. They are not there to fail you. They're there to help you stay accredited,
Yeah.
right? That's their whole point. And then the next step would, and on, I know for Triple HC for a fact, but I'm not sure on JACO, but it probably does have a section on their reapplication or initial application. Are you using a mock survey?
I see.
Right. And who are you using for a mock survey?
Yep.
But then the next step would be contacting someone like me.
Yep.
Or a mock survey specialist to come in.
Yeah.
And I'll stop right there and break, because I could go into the whole process and just ask you. Yeah, let you.
No. I mean, that's one of the reasons we wanted to have you on, because I think you've got a lot of brilliant knowledge there, and we don't have to go through all the details. I don't want you to have to give out all the secret sauce. But if you were giving someone kind of an overview of like, here is the 3 or 4 or maybe 3 to 5 kind of things to expect in a mock survey, or maybe ways to prep for a mock survey, what are some of those 3 to 5 things you would say centers should expect or prep for?
That's easy. Yeah. So I will tell you is that every center, the most difficult situations are contracting, right? Are your contracts expired, right?
Yep.
What is it? Credentialing.
Okay.
Always, and hot topics, for credentialing, they're going to, or for accreditation, they're going to rotate, right? Emergency.
Yep.
I don't know if you guys remember, but during COVID, emergency management was huge, which
Yeah.
I was loving, because I came back from a background in emergency management. But and I still feel a big portion that will help us to take that next step as an industry will be through emergency management. That's another point. So,
Yeah.
but credentialing is huge. Are your physicians credentialed? Is it expired? Is primary source verification completed? Right. And it has to go through your bylaws. Right.
Yeah.
And then also, are they credentialed for procedures that are not being performed at the ASC? And are they credentialed for the procedures that they are performing at the ASC?
Yep.
And those are big hiccups, because without a good CDO organization or process, it can fall behind very quickly.
Is that something that you see is pretty common for surgery centers that you work with, in terms of kind of falling behind there?
100%.
Yeah.
And I mean, for on the independent side at least, right?
Yeah.
And then the third one would be human resource files, occupational health. And those are the big 3 that, almost every inspector or every inspection that I've been in, they're going to ask you for 10 files, right?
Yeah.
20 charts, right? And, credentialing files. So it's, yep, those are the big 3 right there. So typically what I would do is come in and follow that same process, right?
Awesome. And I guess to that end, when you think about it for a surgery center who's, thinking about their process around mock surveys, kind of being prepared from that compliance standpoint, are mock surveys something that centers can they do that on their own, or is it something where you would say they should pretty consistently bring in a third party to be effective?
100%. Now, so someone like myself, what we say bandwidth. Right. Now, I will tell you is that being able to see and having years of experience being in multiple centers, right, and being in contact with industry leaders, being on these boards, it does give a benefit, right, and neat ways to do things. But my first center, I had no idea any of this existed. I was a registered nurse that a pain doc walked in and was like, "Hey, you want to start an ASC with me?" And I'm like, I have no idea what that is, but okay, let's do it. I mean, what up? I was in my 20s, right? Yeah. No kids. And so I'm in the back of his office going, what is an ASC on Google, right? Yeah. And right. And so we went through the whole credentialing process, accreditation process, just by research and my experience with crosswalks, right? So all you have to do really is, for Triple HC and JACO both, they have Triple HC, I think in my mind, does a little bit better job. They have, and there is Quad ASF as well. So, but that's a story for another day. but Quad ASF is an accrediting body, and there might be a couple more as well, just to let you know. And it really depends on if your SQL specialty, what your situation is. Just do your research, right?
Yeah.
But just because I'm more familiar with Triple HC, in the back of their handbook, they have checklists where you can go down and check. And to be honest with you, as a mock surveyor, when I come in, right, I'm using those as a guideline, and that's the way that I was taught from my mentors as mock surveyors. So the big difference though is bandwidth, right? Yeah. And everyone's situation is different. So.
Yeah, I think that makes a ton of sense. Obviously, depending on the size of an ASC, whether they're independent or not, the resourcing, even going back to what we mentioned before, kind of differences between ASCs and hospitals when it comes to accreditation, like some of those resourcing factors seem like they could be impactful in terms of how they're able to handle mock survey prep, whether doing themselves or bringing in a third party. But that seems super helpful there in terms
Absolutely.
of kind of the considerations. Now, if I am an ASC that's going into this process of kind of getting prepped for a mock survey, are there any additional like tips or tricks that you think would be really helpful for an ASC in terms of making their mock survey really impactful?
Oh yeah, absolutely. So my ultimate goal as a mock surveyor, right? My accreditation's ultimate goal is to get facilities to live in the now.
Makes sense.
Right. So it's on autopilot and you don't have to go back and backlog, right? Yeah. You don't have to go back and worry about has it been done or not. So, right. Promoting and looking at structure or dynamics within an organization and then determining how you can live within the now, it should be priority number one. You should have a master schedule, right? You should be trusting and relying on the people that are within their departments and their sector and their jobs to be a part of quality improvement and to help you to complete that. I base all of my performance evaluations on, being a part of quality improvement. Surgical tech walks in and, hey, you asked for these sterilization logs. Okay, well, is everything in order? Yep. All right. Well, what's the benchmark on that?
Yeah.
What's it? Then I'll get what's a benchmark, and I'm like, I don't know. You tell me. You know the answer to that already, don't you? And I'm like, yes, I do. Right? You got. It's not a one-person job because I tell you, if you try to take the world onto your shoulders, and this is really more independence, right? And just coming from experience, it can be done, but it can be done a lot less stressful, right? And lean on the people that are within the departments if you have those resources. But scheduling, benchmarks, right? Good quality improvement, right? Or QAPI, some people call it, just QAPI meetings on a quarterly basis, right? That getting into a routine is the biggest hint that I could tell you. Now, I have tools and all that could help you to fill those out, but I don't think I could describe those over the headphones, right? Yeah, but I will tell you one thing I can describe to you is that I don't see a lot is that you want to summarize everything, right? So like if you have if you don't have it automated, which by the way, there's not enough automation. And I will tell you is that it's because automation has not caught up value-wise to its cost yet for larger organizations, health systems that already have in place, right? Could you imagine how much it would cost to change a giant process, right? Like RCM or whatever it is, from paper to automation, right? Right. From what they're doing now. And so there's not enough automation. But if you don't have automation, you want to summarize everything. You want to have one sheet that has all of your contracts, with expiration dates, right? And you
No,
want to be able to have notifications sent to you somehow. And
that
if you
makes
can
sense.
be notified that way, that's the simplest form that's going to help you live in the now.
Yeah, that makes
Same
sense.
thing with infection control, et cetera, right?
I love it.
Typically, I don't see that. I just see a bunch of paper everywhere.
I can imagine, James. I feel like if there's a theme coming out of this episode, that concept of living in the now, in terms of not only from a mock survey standpoint, but just general preparedness for a surgery center. I feel like that's a strong theme coming out of it, and I love that. And I think that's something even beyond just kind of the application for a surgery center. I think kind of in general for all of our listeners, that concept of living in the now seems like a powerful one to take forward. So with that in mind, though, we do this every week with all of our guests. What is one thing our listeners can do this week to improve their surgery center? And it doesn't have to be related to mock surveys, just anything that you think could improve their surgery centers that they could do
Easy,
this week.
easy. It's always culture,
There we
right?
go.
Yeah. Set up a meeting, look to find a way where someone else can take a leadership position to step
Mm,
up, right? To promote them into growing and spreading their wings. Look to find ways to highlight positives. If you want to change a behavior, you don't focus on the negative. It's not through punishment. It's through promoting the positive behavior that you want to see.
love
Take
it.
them out, go bowling,
Yeah.
right? Get to know who you are working with, because I promise you, it'll be returned to you in tenfold.
Heck yeah. That's
All about
awesome.
culture.
I love that. I'm a big believer in culture. I think that's
As
a
the
that's a
tide rises,
fantastic one.
we all rise, my man.
Exactly. I love it. Love it. Well, James, this has been a fantastic episode. I think there's been a ton of great nuggets from this that, not only our listeners, but, really all the people who engage with This Week in Surgery Centers can take from it. Before we go, anyone who wants to get connected with you on mock surveys, where can the people find you? How can they get in touch with you?
Absolutely. You can call my cell. Can I drop my number, or I
Yeah, if you
guess?
want to drop your
Oh,
number,
yes.
and we'll
call,
also throw it in the show
call,
notes.
call me. I'm available 24/7. But I'm here to help. Right?
Yeah.
I'm not. Yeah. I want to. I believe in the industry. I believe in the business model. I believe this is the future of healthcare,
Yep.
and patients being more informed. So give me a call, 512-496-8854, or you can email me. Reach out anytime. J McClung at reliantmedserv.com. I'm
There we
not going to
go.
spell all of that, but please. And if I don't know the answer, I'll find it for you and point you in the right direction. But hope to hear from you.
Heck
Thank you,
yeah.
guys.
Love it, James. Well, we will make sure that our producers put not only your phone number and your email in the show notes. I think you're our first guest who's given their phone number out, so we love it. You might be setting a new precedent there.
Bring it on, guys. I want to talk to you. I talk at conferences. I attend most of them. So when it comes down to ASCs, I have a passion for it, and I want to see you succeed. So give me a call.
Awesome. All right. Well, thanks, James. We appreciate
Yes,
having
sir.
you on the pod.
Same. Thank you, guys. Have a good day.
All right.
As always, it has been a busy week in healthcare, so let's jump right in. In a story shared by Healthcare Dive, Google Cloud and Epic have announced plans to allow Epic clients to run their EHRs on Google Cloud. Now, this is extra interesting because just a few years ago, Epic actually announced the exact opposite. They called their clients to let them know they would not be pursuing further integration with Google. So, exactly why they changed their minds, we're not sure, but it's certainly good timing for Google because when it comes to market share in the healthcare cloud computing world, they are kind of losing the battle. It's estimated that Amazon Web Services has 40% of the market, Microsoft has 18, and Google only has 12. Hackensack Meridian Health is located in New Jersey, and they plan to be one of the first healthcare organizations to host its Epic EHR on Google Cloud, and will be moving a total of 17 hospitals onto the platform. So, some of the perks would be improved analytics, AI capabilities, and added security. So, we look forward to seeing what this means for Google and EHRs and the entire industry. Our second story comes from Becker's ASC, and it's a recap of some supply chain updates and issues and includes a drug shortage that was actually caused by a viral TikTok video. They provided 11 updates in their story, but here are the four that I will share. The first, the American Red Cross issued a warning about the impacts of a severe flu season on the nation's blood supply. And now multiple states, including Hawaii and Georgia, are facing critical shortages. So just a reminder to donate if you can. Another shortage concern, thanks to flu season, Tamiflu fill rates are 11 and a half times higher than they were at this time last year. And as of 2 weeks ago, 13 Tamiflu generics were in short supply among 6 different pharmaceutical companies. Third shortage here. So last year, Philips Respironics recalled 3.5 million ventilators due to safety concerns. And the device maker recently told the FDA that 2 new potential issues have appeared in their reworked ventilators. So unfortunately, those won't be fixed and redistributed anytime soon. And then the fourth update here. So Ozempic is a prescription drug intended to help people with diabetes and help with long-term weight management. They are experiencing shortages because people have started using it as a weight loss drug thanks to TikTok. Now, if you just Google Ozempic, you'll see dozens and dozens of stories about it. The drug became popular after a few celebrities were rumored to be taking it, and then it blew up like crazy. The sad part is that it has now left people who genuinely need the medication to manage their diabetes unable to find it. And according to another article by the Daily Mail, the government has actually banned the drug from being shipped globally until we can get back on track. So, to see the other 7 supply chain updates, we'll put a link in the episode notes so you can access the full list. Our next story comes to us from Modern Healthcare. The state of Mississippi is at risk of losing over half of its rural hospitals either immediately or in the very near future. Dr. Daniel Edney, the state health officer, shared that 54% of rural hospitals in Mississippi, so a total of 38 facilities, cannot keep their doors open for much longer due to financial issues. These hospitals find themselves in a really complicated and dire situation, and here's why this is happening. First, Mississippi is one of the country's poorest states and has a high number of low income and uninsured patients, which means, unfortunately, a lot of bills do go unpaid. In combining that with a general increase in healthcare costs and labor costs, the situation is just not good. Hospital leaders say they will be out of business before the end of the year without a cash infusion. Now, the Mississippi Hospital Association, the governor, and various other politicians are working on finding an interim solution and then figuring out a 5-year and 10-year plan so we don't find ourselves here again. I mean, if that many rural hospitals close, it will be detrimental to the healthcare in those areas, patient access, all of that. So in the meantime, something to think about, there are roughly 75 ASCs across the state of Mississippi. So even if a portion of these 38 rural hospitals do close, that's going to impact the entire healthcare ecosystem. And ASCs really need to start preparing for how this might impact them. There's going to be nurses out of work, patients looking for safe places to have procedures, and really just a lot of confused communities looking for a place to turn. So it's a good idea to start discussing the possible impact with your staff and just stay really close to this story. And to end our news segment on a positive note, a 9-year-old elementary school student in Wisconsin saved the life of a classmate by performing the Heimlich maneuver on her as she was choking on her food during lunch. Essie Collier, a 4th grader, noticed one of her classmates grabbing her neck and looking distressed, so she ran over to help. And Essie said she watched a YouTube video 2 years prior that showed her how to perform the Heimlich, and that's how she knew what she was doing. Her classmate was perfectly fine after Everything was cleared, and the school plans to honor Essie during their next board meeting. So perhaps we have a future ER nurse or doctor on our hands here, but great job, Essie. And that news story officially wraps up this week's podcast. Thank you, as always, for spending a few minutes of your week with us. Make sure to subscribe or leave a review on whichever platform you're listening from. I hope you have a great day, and we'll see you again next week.